So today we are entering, this is the second class in our series of how to get started sessions. So today we're almost getting to halfway through the course, and the topic for today is intervention mapping, and we're going to touch a little bit about evaluation. We have three objectives. So by the end of the class, you should be able to address these issues. First, we're going to describe intervention mapping. Then second, we're going to look at the 6 steps that are involved in intervention mapping. And then the third objective is to try to look at how we implemented these 6 steps in our own serious games that we developed in the lab, in our own serious game. So maybe you ask yourself, why should we be focusing on intervention mapping? Because maybe you are public health students, and so maybe you are learning these things already in other courses. Well, on the first lecture, I mentioned that serious games are actually 25% technology. The rest, the 75%, is where behavioral science come in, where epidemiology come in, where other technical expertise actually come in. And as you can imagine, you need to actually work or collaborate with many other different experts. So this class will really help you to try to find a way to bring all the other experts together in collaborating, in designing and developing a serious game. So first, I'd like to begin with this slide. It's one of the slides I learned when I was a master's student through Masako Sensei's class in social epidemiology. It's the value chain in behavioral change. Did any one of you take this class or learn about this slide or remember this slide? Anyone? Maybe not. Or maybe you will once I start showing how it is. So usually in public health, you have an organization or a research group or someone interested in behavior change, or even government at times. And they do what they need to do to develop an intervention. They identify a problem, a health problem, and they want to change the situation. So they design the intervention. And at the other side of the spectrum, you have the user, you have the audience, the target audience that is set to receive this intervention. And oftentimes, not always, but oftentimes, you find that we receive, as public health officials or epidemiologists, we receive unfavorable feedback from our target audience. Maybe because they didn't like the intervention, or maybe because they didn't thought it was suited for them or something like that. So there's only one winner in this scenario. It's the organization, because the life of the organization goes on. It never stops. Even if the intervention is unsuccessful or successful, it never stops. So the organization wins, but the audience loses out because they didn't like the intervention. So there's no value exchange. But in another scenario, you have the situation a little bit different. You have a situation where both the organization or the social marketer and the audience both win. The intervention is developed based on the preferences of the audience, and as a result, the audience like the intervention and give positive feedback. So partly the reason we are having this particular session today is to try and help you think about ways to make sure that your intervention that you're thinking about is built on the preferences of the audiences. Okay, so actually, intervention mapping was designed by a certain professor who felt that there was no particular theory or model or framework that really addressed how to bring literature, how to bring stakeholders, how to bring the audience together to design an intervention. He says in one of his papers that he received questions like this from his students, like, how do I decide what intervention method to use? I'm doing research, I want to improve condom use, but how do I decide which method to use? There's so many methods, there's so many examples, but how do you decide on one particular one? But there was no guidance prior to this model, the author says. Another question is, how can I get from program goals and objectives to specific intervention strategies for program participants? Another question was, how do I link program design with planning for the program and implementation? How do I link from design stage down to implementation? So I think this is one of the frameworks that really help us try to link those two ends together. So the authors write that intervention mapping is intended to make steps in planning interventions explicit enough to demystify the process to facilitate collaborative planning by individuals of varying background, so the interdisciplinary part of it. And then they say that unlike a roadmap or a guideline, the framework is interactive. The planner is expected to return to earlier steps in the planning stage, even if they're in the last stage, to refine what they already do, they already done in previous steps, such that they improve as they go in. So it's not just a roadmap or just a guideline. You cannot return back. So it's built for people to move from step 1 to 2, go back to 1, 3, 4, 5, go back to 3, that kind of arrangement. So intervention mapping aims to ensure maximum efficiency of health promotion programs by ensuring that the needs and perspectives of 1, stakeholders, 2, the end users of the programs, and then 3, evidence in the field. So linking all these things together in designing or developing the certain intervention that you are looking at. And in our case, it's probably serious games, right?